So, you just got your ultrasound report back and you see these words bilateral polycystic ovaries. And yeah, it's totally normal if your first reaction is a mix of confusion and maybe a little bit of worry. You're definitely not alone. Over the next few minutes, we're going to break down exactly what this means using expert medical advice so you can walk away from this feeling clear and in control.
Seeing that phrase on a piece of paper can really make your mind race, right? What does this mean for my health? For the future? Well, in this explainer, we are going to cut right through all that medical jargon and give you the clear, straightforward answers you're looking for.
And look, we're not just pulling this out of thin air. Everything we're about to talk about is grounded in expert guidance, medically reviewed by Dr. Saraswathi Ramesh, an OBGYN with over 4 decades of experience. So you can relax and trust that you're getting a real expert's perspective.
Okay, first things first, let's just break down what those words even mean. Bilateral, that's simple. It just means it's happening on both sides, in both of your ovaries. Now, the word polycystic is the one that trips everyone up. It sounds like it means you have a bunch of dangerous cysts, but it doesn't. It literally just means many small follicles. And these are just tiny, harmless sacs that hold immature eggs. That's it. So altogether, this is just a doctor's observation about how your ovaries look.
And here's what I really want you to hear right from the start. On its own, this is just a finding on an ultrasound. It is not a disease. So many women have ovaries that look this way and have absolutely zero other symptoms or hormone problems.
And get this, it's way more common than you'd probably guess. About 1 in every 5 women of reproductive age around the world will have this show up on an ultrasound. So if this is you, trust me, you are in very good company.
You know, doctors have this great way of describing what they see on the screen. A string of pearls. Just picture it, a dozen or more of these tiny little follicles all lined up around the outside edge of the ovary. That's the classic look they're talking about. Okay, so this is where things can get a little confusing, and it's the part we really need to clear up. We need to talk about the connection, or lack thereof, between this observation and polycystic ovary syndrome, or PCOS. They are not the same thing. So, the big question, the one that's probably on your mind right now, is, does this automatically mean I have PCOS? And the short answer is a clear and simple no. Let's dig into why. This chart really lays it all out. Having polycystic ovaries is just an ultrasound finding. You can have it with perfectly normal hormones and totally regular periods. PCOS, though, that's a whole different ballgame. It's a complex hormonal disorder, a syndrome, that usually comes with other signs, like out-of-whack hormones and irregular cycles. And this is how doctors officially figure it out. It's called the Rotterdam criteria, and you can think of it like a checklist. To get a PCOS diagnosis, you need to check off at least 2 of these 3 boxes. So as you can see, the ultrasound finding is just one potential piece of a much bigger puzzle. All right, so if it's not always PCOS, then what is causing it? And what are the signs that it might be something more? Let's get into the why and how behind all this. It's usually not just one thing, but a mix of factors. A really big one for a lot of women is something called insulin resistance. Basically, your body isn't using insulin very well, so it just makes more and more of it. That extra insulin can then tell your ovaries to produce more androgens, so-called male hormones, which can mess up your ovulation. It's a chain reaction. And on top of that, you've got genetics and even low-grade inflammation playing a role, too. So if this ultrasound finding is tied to a bigger hormonal issue, these are the kinds of symptoms you might notice. The number one sign is usually irregular periods. But things like stubborn acne, gaining weight easily, or seeing unwanted hair growth, those are all clues that your hormones might be out of balance. Okay, we've covered the what and the why. Now for the most important part. What can you actually do about it? This is where we shift from just understanding to creating an empowered plan of action. Look, a real diagnosis isn't just based on that one ultrasound picture. It's more like detective work. Your doctor is going to be really thorough. They'll want to talk about your whole medical history, your symptoms, do an exam, and almost certainly run blood tests to get a clear look at your hormone levels and check for things like insulin resistance. It's all about putting the pieces together. When it comes to treatment, it's not a one-size-fits-all thing. It's a step-by-step approach tailored to you. But check this out. What's the very first step? The first-line treatment for pretty much everyone. Lifestyle. That's the foundation for everything else.
And you might be thinking, oh great, I have to lose a ton of weight, but that's not it at all. The science on this is pretty amazing. For women who are carrying extra weight, losing just 5 to 10% of their body weight, just that little bit, can be powerful enough to improve how your body uses insulin, lower those androgen levels, and sometimes even bring back regular ovulation all on its own. It's incredible.
Okay, let's talk about the big one, the one that, for so many people, is the biggest worry of all: fertility. Seeing this on a report can kick up a lot of fears about whether you can have a family. So let's tackle that head-on.
The answer from the experts is a clear, resounding yes. You absolutely can. It might mean things take a little more time or that you need some help from your doctor, but this finding does not mean you can't have a baby. In fact, with the right support and management, women with this condition go on to have just as many children as women without it. So remember this, it's a diagnosis, not a destiny. Work with your team, focus on your health, and stay hopeful.